Welcome everybody, I'm Sergio Gianesini from the University of Ferrara, Italy, and this is a very special initiative for which I'm extremely grateful to Traci Callahan, a huge champ in the beach volley field, and to Dr. Pittman, a huge champ in the vein water field. I'd like to ask forgiveness if I look like in pyjama, but in reality I'm wearing my university center dedicated to sport sweater, in honor indeed of Traci Callahan, who is, as I was saying, a huge champ, not just of the sport field she is representing here, but also in terms of advocacy. Because today we will focus on how to smash the venous thrombosis risk and the chronic venous disease in general. I have just to say thank you to Dr. Pittman because he was responsible for introducing all of us to Traci. So please, Chris, introduce all the world to Traci, and then we will give the mic to her.
Well, absolutely. I've been kidding around. It's kind of peanut butter and chocolate that that's come together and made a delicious outreach and education on venous and lymphatic medicine. So I was first introduced to Traci by a local physician who takes care of many professional athletes, and he's based in Tampa, Florida, but travels all over the world. And we have the good fortune to take care of many of his patients. Dr. Michael O'Neill, I'd like to call him out. And so I met Traci over I think FaceTime. And so Dr. O'Neill calls, I get this FaceTime in the middle of the day, and he's like, hey, I want you to meet somebody, and they're on a beach in Los Angeles. And so anyway, Traci was having some lower extremity symptoms and came to visit, and I'll let the rest of the story unfold in the coming few minutes. But I've gotten to know Traci, her brand, her culture, her tagline, and we become very fast friends. And she is not only a world-class competitor, but has an opportunity to really help with education outreach in venous and lymphatic medicine. So Traci, why don't you tell us about yourself and your tagline? I absolutely love it.
Sure thing. So I'm a beach volleyball player in the United States. I play in our domestic tour here. It's called the AVP, and I also compete on the FIVB, which is the International World Tour, and the Olympic qualifying tour. Yeah, I think like any athlete that's, going after something, we recognize that we only have a limited amount of time to become the best in our certain field. And so we try to find every possible angle that we can to get there. So like you mentioned, I'm friends with Dr. O'Neill, and I was mentioning to him, it's the craziest thing, but I take a day off and my legs feel heavier the next day. So he was like, oh, I've got somebody, I need you to call. And that's when I got in contact with you, Dr. Pittman. And then when I finally got a chance to, to go to your offices and meet you, and I got the ultrasound assessment, and you said, well, you've got vein disease. And I'm like, vein disease? This makes so much sense because I've felt such heavy legs, as hard as I work to be light on my feet, to recover, to eat the right things. I'm doing, check all the boxes. Here was something that was completely outside of my control. And then we went through obviously the history of my mother and my father, who also have vein disease. And it was just, I was fascinated to find out that I knew nothing about this really big topic that I've never talked to any doctor about. No athlete that I've ever come across has mentioned that this is something they deal with. And I had no idea that even within like the US alone, there's about, I think it was 80 million Americans that are suffering from this. So yeah, and then obviously around the world as well. So yeah, so after that consult, that visit, I was able to have better understanding of, that I need to take certain precautions now, and there's things that I can do to make sure that I'm able to get the proper blood flow, and my veins are working great now. So yeah, so that's why I'm here.
And thank you so much for that also, because this one to be a really an informal conversation, but filled in also with the science and experience from the field. I think an important message to give to everybody is that in reality, you have to deal with what we define the peripheral heart. So the calf muscle, for us as vein experts, is considered really like a peripheral heart that is propelling the blood back to the heart. And the reason why we are so excited here is that this peripheral heart has to be managed properly, considering that indeed one person out of two even can have some venous disorder. That goes with Darwinian evolution, if we think about that. We don't really have varicose veins usually on our upper limbs, but we have them on our lower limbs because we evolved from quadrupeds to bipeds, and we are overwhelmed by the force of gravity. And of course, with the wonderful job you are doing, and I'd like to ask for an extra minute of description of the amazing achievements you have around the world, because we were chatting before and you were talking about Doha, Mexico. So update us also a little bit about the beach volley world, because it's a surely fascinating world. I think it's very important to dive into the topics of how to move forward in an evidence-based way to treat this condition. So could you give us just a glimpse of your next appointments so that we also stay positive just to the hope of traveling again rather than COVID?
So the FIVB just created and announced the first tournament they had for men and women, which was in Doha. So that just completed. I wasn't able to go on that trip because that's the Olympic qualifying tournament right now, and I'm out of that for 2021. I'm pushing for 2024. So my next tournament will be in Bulgaria in May. I believe it's the end of May. So I'm looking forward to that.
And we surely will come and clap you, because Bulgaria is, of course, involved in this global initiative for which we are here today, Vein Week, with particular help of Professor Elena Goranova, a dear friend of ours. And we were discussing before about the compression role of the water. Bulgaria is a wonderful country full of thermal centers dedicated indeed to hot springs and, again, water compression. Because we will dive a little bit more into the topic of certified compression in these next 30 minutes. And we were discussing with Traci about the luck that beach volley players actually have a lot of time of being nearby the seaside. Because water in reality is creating a compression, natural compression, that we don't perceive, but is actually even 4 times higher than the usual stockings we use. So a first take-home message in this public venous awareness initiative of today is enjoy the sea as soon as possible, as soon we'll be free again, and enjoy it fully, meaning go on the way with the water up to your navel, so that you can enjoy the gravitational pressure and also the hydrostatic pressure created by the aquatic environment. So this is another take-home message. So now the schedule is to have a little look at the evidence-based data we have in terms of compression, addressing this data to the colleagues of Traci. And Traci, as a nice ambassador, will make us questions about something that eventually is not clear, and we will make questions to her about her ward and how the athletes perceive the topic indeed of venous disease and compression. So talking about smashing the venous thrombosis risk, we really dived into the sport topic, and here we are trying to do some sport, of course, not at the level of Traci with Professor Urbanek, a dear colleague from Poland, because of course sport can be beneficial. It is absolutely the most powerful drug if done in the proper way. So absolutely beneficial, but also harmful if not practiced in the correct way, particularly if there are comorbidities that could affect our performance. This is in honor of the good time in which we were together with dear friends like Professor Leon, Professor Falles, Professor Raffetto from Harvard, all great athletes, of course, apart from me. And we could ask ourselves if we were wearing or not compression in this nice run in New York City. If we really look at the literature as scientists, we see, for example, this paper that is saying that there is not a huge benefit in using compression. Yet, if we look at the market, we see, and this is a question I will make to Traci later on, that athletes in particular are exposed daily to commercials talking about the use of compression garments. It's very important to get out from today's education experience with a clear concept that we don't have to put together apples and oranges. We don't have to put together certified products and not certified products. And here is the advocacy of today evidence-based revision. So does it make sense to use compression in sport? And this is a real question I will make to Traci later on. Well, if we really dissect the literature, like in this revision article, we see that we have solid data testifying that proper compression is helping in delaying the onset muscle soreness. So particularly in the recovery phase. So I will ask Traci about her experience in the recovery rather than during the action. You see us here during post-Congress run with Professor Raffetto, using compression in reality because there are other papers showing a clear benefit of compression. Again, it's really important then to use the proper compression to have a benefit, because if not, we get the risk of falling into advertisements that could be considered fake news in which whatever product seems to be beneficial. This is another paper that is showing in runners in particular an improvement, as you can see, in the endurance, in the running economy, in the biomechanical variables. It means the inflammatory markers we have in our blood. It's really like a drug, like an anti-inflammatory drug that is helping you recovering from your eventual exertion. We could discuss later on about the temperature effect, meaning that usually it is believed to be associated, the use of compression, with the perceiving of hot, for example, feeling, of warm at least. In reality, compression is propelling away the venous blood. So the venous blood is what is bringing heat in reality. So proper compression is actually associated not with an increase of the heat perceived. This is interesting because it's showing that even in patients with chronic venous disease, so patients who have varicose veins, proper compression can help in improving the physical exercises of walking. But with the right compression, you see the millimeter of mercury, so this is the class of stockings you want to use. And there are also papers like these ones that are showing that there is a dose effect in these millimeter of mercury. So choosing the proper compression, choosing the proper value of compression, the proper millimeter of mercury, and it must be specialist, of course, doing that. It cannot be simply a sport store employee suggesting the product. Is fundamental. This is a very interesting data because it really goes into the powerful calf of Traci, and I really suggest you to Google Traci. I did that today. It is amazing, the achievements she has been obtaining so far. When she is jumping, she's activating this muscle, and it has been demonstrated by electromyography, so a really objective measurement, that this pressure value relieves the triceps psoas fatigue far more than this pressure value. So the importance of dosing the effect. But maybe, of course, we are not high players like Traci. We are everyday people who are used, for example, to travel. And this is another paper we published with our research group about the use, for example, of compression while we are sitting, for example, for 4 hours during a flight. And we demonstrated the clear benefit in terms of the swelling of the lower limb, pointing out the importance of proper sizing also of the stockings to have this effect. So it's important to have the proper dose, the proper size, the proper prescription. Now, this is another paper for which I like to deeply thank our PhD, Erika Menegatti, who is the leader in this research line in our group. It's a publication for the experts on the field in general on Journal of Vascular Surgery. It was a couple of years ago, in which we basically asked healthy subjects to walk on a treadmill in a standardized way. This is a validated scale called Borg that is telling you the perceived exertion, where 6 is the exertion of playing golf with Dr. Pittman, and 20 is the maximum exertion, which is playing beach volley with the champ Traci. So if we use compression, with the proper value, we demonstrated that 30 minutes of continuous walking on the treadmill in healthy subjects have a benefit in using a compression in terms of lower limb volume, but also in terms of perceived exertion. So I will be less tired using proper compression, walking for 30 minutes, even if I am an healthy subject. But then the patient or an healthy subject could desire to go walking with the dog. So intermittently, not continuously like on the treadmill. So you stop and go, stop and go. And in reality, we don't have that much data in the comparison of what happens in the venous field, walking continuously versus intermittently. For this reason, we use one of the most useful research lab, the Sport Award, for which we thank once again Traci for being here with us today. This is another publication of our group done on the golf field, because the golfers are the ones who are walking toward the ball, they stop, they shoot, and they walk again. So it's an intermittent walk, exactly like when we are walking downtown, stopping in front of the different shops. Now, we know that the hole 1, we are not the same than the hole 18. So again, the perceived exertion. I think this will be another question for Traci, because we used also the sleeves rather than the full stockings all the way to the tip of the foot. We used different pressure values, and we demonstrated that just a specific pressure value was able to obtain a specific effect in terms of lower limb volume control and in terms of perceived exertion. We found no difference in using proper compression in the form of a sleeve rather than a full stocking. But of course, it has to be the proper compression. So I will ask Traci later on her experience with sleeve versus normal stockings. This is another publication of our group for all the ones who are standing up for 30 minutes in their occupational activity or sitting for 30 minutes, healthy subjects. This is technical, but it is just showing that even 30 minutes sitting or standing or walking can benefit from proper compression in terms of swelling. And this is demonstrated also by bioimpedance data. We are going too technical now, but just to tell you that there are objective measurements that are demonstrating this. This is showing how it is important to measure the circumference, not just at the ankle when you're buying the stockings in a shop. You need to measure in different parts of the leg, like if it was a jacket. If I have shoulders that are different from the one of Dr. Pittman, we will maybe have the same size, but we will need some adjustments. So that's the same concept. And this is some other investigations we are doing, for which we are literally on our knees, as you can see, collecting blood and trying to understand even more the powerful effect of proper compression at the biological level. It's very important, this is more for the specialist, to have a proper way of collecting data. For example, many of the studies are usually done with patients just standing up. But we should remember that our patients are actually walking, and sometimes they're walking with a dog. So we have to reproduce these conditions to really come to a conclusion. Coming to a conclusion, and here I would like Traci to focus on the next questions, because we should really focus on beach volley. But in reality, it really depends on what sport we are talking about for the proper compression, because we have some data showing, for example, the benefits in basketball players. And Traci will be happy in knowing that we have already data showing the importance of proper compression in volleyball players, in particular in the jumping activity, particularly in the female rather than in the male as a benefit. Of course, these are preliminary data that requires far more sound investigations, but we have already some evidence there, as we have some evidence showing in the upper limb the benefits in terms of flow using proper compression. This is about fake news. If you read this paper from a magazine, basically from an everyday journal, they were claiming that soccer players were hurt by stockings so much that they were like cutting them. This is the clear demonstration that the stocking was prescribed not in the proper way, because we clearly demonstrated that proper compression can improve the venous return so much that if we change sport and we go to the cyclists, it is so powerful, the fact that some categories cannot use stockings because it is considered doping for them. Because there is, as you can see, an improvement in the performance of the sport activity per se. You see that failure over here that is saying that the lack of evidence on the topic is disturbing. So when there are commercials that are proposing stockings, be sure that you're in contact with a specialist, be sure that you are going to receive a certified product, because if not, you get the risk of having commercials that are simply saying to you that there is an improvement in performance without really explaining to you how, the features of this product and the literature behind that. Part of what I've said is available for the specialist in this open access document we published after the last in-person meeting of the WIN Foundation in Cortina, where we were indeed on the Alps to co-work with the World Ski Championship. This is the paper I was mentioning before to Traci, that is showing that 40% of the medical websites are including fake news that are shared up to 450,000 times, for which we are now working with more than 70 societies around the world to be all together in person, connecting experts, informing patients during the once-in-a-lifetime opportunity of the Universal Expo in Dubai. You can already report over here eventually encountered fake news in this website, and our scientific committee will get back to you, and the scientific committee will also draft a document that will be presented during the Expo. As you can see from our previous in-person activity, our world meetings have always been accompanied by strong sport initiatives, like basketball, soccer when we were near Venice, here on the Alps with the world ski champ Christian Gedina, and with another sport and vein champ that you can see in his sport outfit, Dr. Pittman, together with the other huge experts we still thank for having joined us in Cortina in Italy, and that we are waiting for in Dubai in 2022. With this, I conclude my talk, and I pass the mic to Traci and Dr. Pittman for eventual comments, questions, and if not, I will make questions to you.
I'll
Traci.
start. Yeah. So, you know, as I was listening to you explain that, I was thinking sort of back on my understanding of like compression, and you know, since I was 20, so maybe about 10 years ago, I knew that wearing something on my legs was helpful. So I'd go on flights and I would just go to the local drugstore and grab some socks that looked like the right thing. And it didn't really work, but that's kind of what I thought was the thing to do, you know. And it wasn't until I actually was able to try on certified compression. I use it oftentimes, like I'll go from practice, I'll keep it on and I'll go to the gym, train, and keep it on for my drive home. So that's sometimes anywhere from half an hour to an hour after I'm done training completely. And I train 6 days a week, and I don't have really any problems. I've worked hard to be in this type of shape, but at the same time, I do notice a huge difference when I am wearing that compression that is the certified versus just like compression tights from the local, you know, the local store over here that they're really cute and they've got, you know, great design, but they're not like the medical compressions, which you were talking about. So I think a lot of athletes would be very, they would want to know this information, because I think we get fed sort of what our, you know, our coaches tell us or what we've seen, or pass on information from one person to the next. And just from my experience having, thankfully to Dr. Pittman, I was able to experience what it's like to be able to wear certified compression. But if I didn't know, I would just be buying the thing from, you know, the shoe store or the drug store. So, or just wearing the tight pants thinking that that was compression.
And that's an outstanding contribution. And I'd like also to point out that nowadays, thanks to the certified companies who are really into this science, medical products are actually lifestyle products, are fashionable products. So I see, for example, in Italy, of course, we tend to be a little bit fashionable, and the patients now realize that you can have fashionable products that are coming from the medical expertise, but that are not, of course, medical in the sense of not being aesthetic products. They are absolutely cool, I would say. So I would also like to ask you if you perceive that there is a resistance in the sport world toward these products, or are they looking for that? Because what I've seen is also become a sort of trendy thing to have these compression products, but they really look like a little bit without orientation, and they get some. I saw, for example, in the gym of mine, some good athletes using things that were like more for fashion rather than. So do you have the feeling they are a little bit confused? Or
Absolutely. I think
Yes.
there's a lot of confusion. And then what ends up happening is athletes, and this was my own experience as well, will try a compression, and we're wearing something extra. It doesn't really seem to have an effect, and so we kind of abandon it. So that's what I think happens with a lot of athletes until they've actually tried something that they know has worked, because it's been like the medical grade compression that you're talking about.
And have you had the chance of trying knee high versus a thigh high? Because with the huge impact you have on your knees, I think in beach volley, the fact that you have thigh high could have a difference. Maybe we don't have data yet, up to my knowledge, in terms of stabilization of the joint. For sure, they are stabilizing the muscles. That's a benefit for sure. But do you have any experience from the field on that?
So I haven't, during my competitions and trainings, I haven't worn any of the thigh highs. I've only worn the shin sleeves. So that's been my experience there. But I would definitely be interested in trying that, mostly because I have had some knee problems, little tendonitis here and there, and I'd be curious to see, how it would feel having maybe wearing something a little bit higher.
And do you confirm the data I was reporting before about the delay muscle soreness onset, meaning that the strongest data are there in reality in terms of science? That doesn't mean that they don't help during the physical activity. We need more data on that. But in reality, my assumption, this is just my assumption, is that the biggest benefit in volleyball is not so much when you are playing, but maybe right after, because when you are playing, you're talking about an elastic product that is more adapting to the strong impulse. So you really have to customize by sport. To the contrary, if you try to ski, or if you try motorbike with stockings on, I say that on my experience, the effect is unbelievable in terms of, I'm talking about empiricism over here, up to my knowledge, but that kind of slow movement is really feeling the benefit of compression in our experience. In terms of delay muscle soreness onset, I was talking also with fencing athletes, and they were telling me that that was making a difference. Is it like that for volleyball as well, or?
Yeah, so, and with our sport, we play in a tournament where we'll have sometimes 2 or 3 matches a day. So a match, you're warming up for 30 minutes, the match will last for an hour, and you're jumping, sprinting. It's very anaerobic. It also has an aerobic element as well. But it's definitely something where we're not just, kind of jogging, but it's intense movements, that are going to be very taxing on the body. We have to do that 2 or 3 times within a day. So what I've noticed and what my protocol is I'll wear the sleeves during my competitions, and then at night I'll wear the socks. And so that keeps my legs fresh, because it doesn't, if you play Thursday, Friday, Saturday, the championship game is on Sunday. I mean, that's a lot of days of, back to back, warming up, cooling down, warming up, cooling down, and it's going to take a toll. So anything that I can do to minimize the effect, and especially the perceived effect of that buildup of just like the heavy legs, that's going to make a huge difference, not only in my physiology, but also in my confidence going into that championship match on Sunday.
Another topic I wanted to touch with you is sport varices, meaning that you represent a category that is really propelling blood, because your peripheral heart, so your cuff, is really squeezing, right? That's how the blood goes back. And another fake news we have over there is over-treatment of sport athletes, because sometimes you have dilated veins on the lower limbs just because you overload of volume those veins. That doesn't mean that they are not working, they are simply overloaded. And these poor colleagues of yours actually get operated on without a real reason, just because they are dilated. So that's another thing where we should, I think, bring awareness. And I will touch this point also with Dr. Pittman, because in my career, I've seen a lot of indications that were over-treatment to athletes. So athletes should be aware that it's not just about venous dilation, and it's not just about not having venous dilation. You could have a perfect leg, but you could have the symptoms without having evident varicose veins, as you could have dilated veins that are not varicose. They are just dilated because you are like Arnold Schwarzenegger. You are like pumping up a lot and creating the effect. So would you comment on this, both Traci and Chris, meaning have you ever had an experience with your colleagues in the field saying, oh, well, I have dilated veins, maybe I have to be operated on? Is that something that is happening, or symptoms that are there and there is some confusion? Or
I think in my field, there's not a lot of talk about vein disease at all. So this would be a very new topic for a lot of my colleagues.
Yeah. Chris?
Well, absolutely. Look, I'm enjoying this so much, you guys. I mean, this is fantastic. Well, absolutely, and that's one of many reasons why Traci has such a powerful story to tell and to share, because her story is very common, and as Dr. Gianesini and I both know, there's many patients who are suffering in their 20s and 30s who have symptoms long before you see anything on the leg. And Traci has, perfect legs, but she's suffering. So absolutely, I'll have people come in with bulging veins, maybe, and very little symptoms, or that are just physiologic because they're of low body fat and in excellent shape. And then you have someone like Traci who, was suffering with symptoms every seventh day that she took off. When we examined her in the exam room, she had some mild pitting. Okay, she's 33 years old. She had pitting in her ankles. We did an ultrasound. Not only did we see some enlargement of the veins, the superficial veins under the skin, okay, but they were leaking, or what we call reflux. But another thing we do in our offices that we believe every practitioner should do who's treating or diagnosing superficial venous insufficiency is we evaluate edema. It's so easy to do. And so we were able to detect peri-GSV, or around the great saphenous vein, swelling. We could see it from her ankle to her mid-calf. And this is underappreciated, I think, Sergio, by a lot of venous practitioners. It's something we need to do more research on. We have been correlating serial ankle circumference, a pitting scale, and ultrasound detection of even trace edema on ultrasound for many years now. And so in any case, this is fantastic, and I totally agree. Thank you.
I have just two comments before finishing my part. One is about the transfers you professionals do, because you told us that at your so high level, you're going to go to Mexico, but then you're going to go to Doha. So you have like 8, 9, 10 hours flight and more, of course. So it is pretty strange to me that there is not awareness on this topic, because I guess you're arriving in a place, you will develop edema over there, and you're going on the field already affected by the journey in reality. So and indeed some of these investigations I was quoting were coming from volleyball players who are used to use stockings when flying. So is there any awareness in the sport teams about this when they are flying, that they should be aware of the edema control of the lower limbs? Or?
Yeah, so I would say, so there is a device that a lot of athletes use right now that it's a compression sort of device. It's a machine that pushes, the blood flow and does the graduated compression. So for a while, I was transporting this device with me on the plane that I would take, and take it to my hotel and lug it around. And so athletes are aware of machines like this that can help them out. And a lot of physios know about these machines. And they've worked great. I think a simpler solution would just be wearing something like compression socks. It travels a lot easier. But actually the first time I was in Italy, I was there for a volleyball tournament when I was in my 20s. And when I got off the plane, my ankles, I swear, were 3 times the size. And my teammates were like looking at me and pointing and like sticking their fingers in my ankle. And I'm like, what did I do wrong? Like, I must have not gotten up enough times on this flight, or, maybe I should have been, flexing and pronating my foot more. So I thought maybe I did something wrong. Nobody else has this problem. I did something wrong. But I think when we travel, we're very aware, like, I need to get up and move around. I need to make sure I'm hydrated and drinking enough water, because when you get off the flight, you may have 1 or 2 days that you can recover and kind of get prepared for that first match. So it's really important. And I think athletes that I encounter are trying their best to have the right protocol. I don't know if they know that there can be a simple solution to all of that, because when you're traveling for a long, a long distance, traveling across the world, sleep is also very important. So having to get up and walk around on the flight, every 30 minutes isn't really ideal, and it's not what you want to do. But at the same time, you don't want to be sitting in your chair for 6 hours up in the air, having all of that swelling taking place in your lower extremities.
Absolutely. And indeed, if you have a pool when you arrive there, a good thing is just to enjoy some pool activity, walking, not swimming, but just using the pressure. Last comment on mine. Unfortunately, we are in a COVID time, and it has been demonstrated that COVID is associated with a significant increase of the thrombotic risk of patients who are eventually also simply asymptomatic positive. Venous disease is per se associated with a risk of thromboembolism that it ranges from 4 to 10 times even. So it's very important to be aware of this. I don't know if you have heard that even Serena Williams had a spontaneous DVT that is very probably also associated, of course, on one side on the genetics, because some of us have a genetic predisposition, but also sometimes the muscular stretch can lead to an injury also at the vessel level. Do you think there is awareness also on the thrombotic aspect of the disease in the athletes of your group, or is that another area where we have to work more?
I don't think there's any awareness of that going on right now, to be honest with you.
Which is the leading cause of preventable death, by the way. And that goes with the other big topic, that is edema, in the sense of lymphedema, that is a hidden epidemic as it has been defined. And with also not just the ground floor, but also at the first floor, there can be some venous troubles with the pelvic venous disorders. And that's a topic of gender equality, because everybody knows very probably male varicocele, but not so many knows about the female varicocele. So you have a significant part of the female population, also young ones, who are having issues with like pain, distress at the lower abdomen, that is actually associated with the venous reflux, that in the vast majority of cases is not addressed to the proper specialist. So with this, I think we have indulged too much in your generosity of being with us today. So if Dr. Pittman does not have any other comment, I'd like a final remark from you with the final update for your career will be then maybe Doha next? No,
Doha just finished. So for me, my first tournament will be Bulgaria at the end of May.
Bulgaria, you told me. So when is going to be that?
I'm not exactly sure the date, but I know it's the end of May.
Are you going to be in Sofia?
Yes.
So we have to put you in contact with the Bulgarian Venus Forum.
Sounds great.
And have a talk all together. So if you allow, the invitation is next webinar together will be with Dr. Pittman in US, myself in Italy, and you in Bulgaria together with Dr. GRDAUTED, who is our friend from there. Okay. So thank you so much. It's really so appreciated, and thank you so much, Dr. Pittman and Vein911 for having made this possible. And do you say break a leg? Is it like a bad omen? Is it a bad omen in English to say break a leg? Like, at least don't break a leg.
No, it's not a bad omen. This was fantastic. I enjoyed every bit of it. It was fantastic. Thank you so much.
Let's hope we score 1 point against the thrombosis thanks to Traci. So we smashed at least one.
I think we did, and we look forward to future installments to start in Bulgaria and beyond.
Definitely.
Thank you so much. See you.
Thank you.
Bye.
Thank you.